Ravensbrück, Germany, winter of 1943. A pale sun rises over the barbed horizon, its light fractured by frost on the wire. Inside the women's camp, silence lingers like ash. Prisoners line up in thin uniforms, their breath turning to smoke in the frozen air. Among them stands a young Polish woman, her arm bandaged in rough linen. A guard approaches, holding a small metal jar, a skin cream said to heal faster than nature itself. She doesn't know the name on the label. To her it's only a jar. But behind that name is a company whose products would one day glow on department store shelves across post-war Europe. The cream is applied to open wounds. Infection, they say, is part of the test. Nearby, a doctor in SS uniform takes notes, indifferent to the whimpering. The brand's formula is being perfected, not in a lab, but on the living flesh of captives. Years later, the same brand would advertise beauty, purity, and trust. But beneath every jar's glossy surface, a secret remained, one born in the cold corridors of Nazi experimentation. The question that lingers is not how the company survived, but what it chose to forget. By the early 1940s, Nazi Germany had built a war machine that demanded not only weapons and soldiers, but science. Every factory, laboratory, and corporation was called to serve the Reich's grand design. Industry and ideology fused into a single system of exploitation. From pharmaceuticals to cosmetics, companies competed for the favor of the Nazi elite, promising discoveries that could strengthen the German body and prove Aryan superiority through biology. In Berlin, a network of industrial chemists worked under the banner of efficiency and innovation. Among them stood a modest cosmetic manufacturer, founded decades earlier with the simple aim of producing affordable skincare. Its reputation for quality had grown steadily through the 1930s, until the war changed everything. The company, like many others, found itself at the doorstep of the Third Reich's scientific bureaucracy. The SS sought creams and ointments to treat soldiers' wounds, frostbite, and burns. What began as a commercial opportunity would become a moral abyss. The Reich's obsession with medical experimentation was rooted in its twisted ideology of racial hierarchy. Concentration camps became laboratories of cruelty, where human suffering was repackaged as research. Prisoners were infected with gangrene, exposed to freezing temperatures, and forced to test drugs, serums, and topical compounds. For the SS, these camps were ideal. No ethical limits, no accountability. At Ravensbrück, the largest women's concentration camp in Germany, the victims were chosen not for their crimes, but for their vulnerability. Many were Polish resistance fighters, political prisoners, or civilians seized during Nazi occupation. They were referred to as Kaninchen, rabbits, the experimental subjects upon whom SS doctors tested new surgical methods, sulfonamide drugs, and antiseptic creams. By 1942, the war on the Eastern Front had become a nightmare of infected wounds and frostbite. German soldiers suffered in the cold, and military doctors sought fast-healing treatments. A proposal emerged: a cosmetic cream reformulated for battlefield medicine. In theory, it could heal burns and regenerate skin. In practice, it would be tested not on soldiers, but on prisoners. Corporate scientists from Berlin collaborated with SS medical officers through intermediaries. The company provided chemical compounds. The SS provided test material. Behind the sterile language of memos lay a transaction of horror. Each jar of cream was numbered and logged, its results measured in human pain. The German scientific community at the time was not blind to these acts. Many knew, few protested. Some industries directly financed the research in exchange for exclusive formulas. Others looked away, claiming ignorance while reaping profits from state contracts. It was a culture of collaboration built on silence. The cosmetic brand's internal documents would later reveal coded terms like clinical trials in special facilities. The meaning was clear to those involved. Reports of swelling, necrosis, and infection were sent back to the company's chemists for analysis. Laboratory notes were filed, formulas adjusted. Every new version of the cream promised better results, better healing, smoother regeneration. And behind every improvement was another prisoner, another scar. In public, the company continued to market its products to German civilians, promoting beauty and hygiene even as the war consumed Europe. Advertisements spoke of purity and perfection, echoing the very language the regime used to define its racial ideals. It was no coincidence. The line between vanity and ideology blurred completely. What began as scientific collaboration soon turned into moral complicity. The company's executives justified their work as patriotic duty, a contribution to German medicine. But the experiments had nothing to do with healing and everything to do with dominance. As the war intensified, so did the testing. New compounds arrived at Ravensbrück in plain glass jars, labeled only by batch number. The doctors recorded how long it took for wounds to rot or heal under each formulation. Some women survived, bearing disfiguring scars. Others were executed once the data was complete. The name of the brand would vanish from those reports, replaced by bureaucratic codes, but the link was never erased. Those who handled the shipments in the camp knew where the jars came from. And when the war finally turned against Germany, the same company would begin quietly preparing for another kind of survival, one built not on science, but on concealment. The next step in this story lies deeper, in the collaboration between SS laboratories and corporate boardrooms, where the language of efficiency concealed the language of atrocity. The world of Nazi science was a hierarchy of obedience. Every discovery, every experiment, every formula served the larger goal of sustaining the war and affirming racial ideology. Corporate laboratories, once private centers of innovation, were drawn into this orbit by pressure, ambition, or opportunism. At the top stood the SS Medical Division, directing research not only in military medicine, but in human experimentation. Its reach extended into every corner of German industry, including companies that would later claim to have been unaware of the atrocities. Ravensbrück became a focal point for such cooperation. Located north of Berlin, the camp held more than 130,000 women during the war, political prisoners, Jews, Romani women, and Soviet captives. It was a world built on obedience and silence. The SS established a medical block within the camp, officially named for infection research. In reality, it was an experimental ward where women were deliberately wounded and infected with bacteria to simulate battlefield injuries. One of the projects approved by Heinrich Himmler himself sought to test regenerative skin treatments. The Cosmetic company, still operating in Berlin under its civilian brand, was brought into the program through an SS intermediary who promised them exclusive access to new biomedical compounds. On paper, the collaboration was scientific. In truth, it was exploitation under the veil of research. Prisoners selected for the trials were often told they were helping the German army. They were injected with bacteria, sometimes with fragments of wood or glass embedded into the wound to create infection. Then ointments and creams supplied by the company were applied to measure their therapeutic effect. Results were recorded meticulously, not for compassion, but for data. The company's laboratory reports from that period, preserved decades later in archives, list ingredients like zinc oxide, cod liver oil, and antiseptic agents, ordinary substances used in wound healing. But the testing method was extraordinary in its cruelty. The scientists who analyzed the results were rarely informed that their data came from human experiments. In corporate documents, references to field testing under extreme conditions were meant to hide the reality of the camps. Within Ravensbrück, the women began to understand the pattern. Those whose wounds healed slowly were kept alive for observation. Those whose infections worsened were executed to make room for the next batch. The guards referred to them by number, not name. Yet some prisoners secretly documented what they endured. After the war, their testimonies would expose what polite reports and coded memos tried to conceal. Meanwhile, the company prospered. Wartime demand for medical supplies grew, and government contracts brought stability while other industries collapsed under bombing raids. Executives in Berlin spoke of moral neutrality, claiming that their duty was to science, not politics. But in Nazi Germany, neutrality was complicity. Each jar sent to the SS bore the invisible seal of approval from a system built on dehumanization. By 1944, as the Allied forces advanced, the evidence of such collaborations began to vanish. Laboratories burned documents. SS officers destroyed correspondence. The company's wartime activities were rewritten as civilian production under duress. When the war ended in 1945, the brand swiftly rebranded its image, from patriotic supplier to post-war innovator. In the ruins of Berlin, the same chemists who once answered to the SS now pitched their products to occupying Allied markets. New labels, new slogans, same formulas. The war had changed the world, but not the moral calculus of profit. Yet buried in the archives of post-war trials were traces that refused to disappear. Investigators at the Nuremberg Medical Tribunal uncovered testimonies linking corporate names to camp experiments. Few executives were ever charged. Many claimed ignorance, blaming individual researchers or rogue officials. The cosmetic brand's involvement remained obscured, shielded by bureaucratic distance and economic necessity. The legacy of that silence would last decades. Consumers would see only the advertisements, the promise of beauty and purity, never the shadows of Ravensbrück behind them. It was not merely a crime of war, but a crime of forgetting. And it is within that silence that the next chapter unfolds. The different faces of the same horror, told through the angles of humanity, science, and profit. Every atrocity has more than one face. To understand how a cosmetic brand could become entwined with a system of human experimentation, one must view the story through several lenses: the human, the scientific, and the moral. Each angle reveals a layer of complicity and a deeper wound beneath the surface of what the world would later call progress. Ravensbrück was not merely a camp, it was an empire of silence. Behind the barbed wire, the women endured hunger, humiliation, and the slow erosion of identity. When the experiments began, they were told little, only that they were chosen for medical procedures. Some believed it might mean release or better treatment. Instead, it meant agony in the name of science. Test subjects, mostly Polish resistance fighters, were chosen for their supposed physical resilience. Their legs were cut open with surgical precision, foreign substances placed into the wounds, and then wrapped in bandages soaked with experimental creams. Infection was deliberate, pain constant. The women learned to recognize the sound of boots approaching the infirmary door. It meant another test, another wound, another day closer to death. Among them were women like WWII, who later testified at Nuremberg. Her calm voice described how the wounds were opened repeatedly, the muscles exposed, and the creams applied, while SS doctors took notes. She survived, but her legs bore scars for the rest of her life, living proof of what industrial ambition could inflict when untethered from ethics. To those outside the wire, these women were invisible. To the company's executives, they were specimens. To history, they became witnesses to the cost of indifference. The human angle is not about statistics, it is about faces. Faces once smooth, then scarred by the very creams that promised healing. In the laboratories of wartime Germany, science was no longer a pursuit of truth. It was an instrument of power. The cosmetic company's research division worked in close contact with university departments that received SS funding. The line between civilian and military research dissolved entirely. The experiments at Ravensbrück were designed to simulate battlefield injuries. Sulfonamide antibiotics were the standard treatment, but German chemists sought topical alternatives that could be mass-produced for soldiers. The cosmetic company, skilled in formulating creams, was seen as a valuable partner. Its compounds combined antiseptics with emollients meant to accelerate healing. On paper, it was innovation. In practice, it was torture disguised as science. SS doctors recorded healing rates, tissue regeneration, and infection control. The company's chemists in Berlin received the data and modified formulas accordingly. Each iteration was labeled as a scientific advancement, but no amount of progress could justify the means. These were not trials. They were orchestrated mutilations conducted under clinical pretense. The war created an illusion of necessity. "We must test on humans," one SS doctor wrote, "for the sake of our soldiers." Such reasoning echoed through every level of bureaucracy. Science became a shield behind which cruelty flourished, and companies that participated, even indirectly, contributed to legitimizing that ideology. After the war, corporate scientists defended themselves by claiming ignorance. They insisted they never visited the camps, never saw the victims, never knew the truth. But the data they analyzed, wound progression, gangrene development, post-mortem results, could not have come from voluntary subjects. The evidence was written in the language of suffering. Science had been weaponized, and the corporate laboratories became its accomplices. The test results were presented in meetings, graphs, and charts, detached from the screams that produced them. In those sterile conference rooms, moral distance was the first requirement of success. The tragedy of this era is not only in the cruelty committed, but in how methodically it was justified. The scientific angle reveals the power of detachment, how numbers, charts, and clinical terms can transform murder into data. For those inside the system, doctors, chemists, clerks, the process of dehumanization was gradual. The war normalized moral compromise. Ambition, fear, and ideology fused into obedience. Some believed they were contributing to victory. Others simply wished to survive. Few asked questions. Within the company, loyalty to the state became a matter of survival. Refusing SS cooperation could mean arrest or closure, yet compliance was often eager, not coerced. The allure of government contracts, scientific prestige, and post-war opportunity outweighed conscience. Documents show enthusiastic correspondence between company representatives and SS officials, discussing project success rates as though human beings were raw material. Psychologically, it became easy to separate the laboratory from the camp. The people mixing compounds in Berlin did not see the bodies in Ravensbrück. That distance made complicity possible. It allowed the illusion that this was research, not cruelty. The same mental division persists in many moral crises. When action is indirect, responsibility feels diluted. The victims, meanwhile, found resilience in fragments. Through whispered prayers, silent defiance, and the will to remember. Even amid despair, they formed a secret network to record the experiments, smuggling notes hidden in fabric scraps. Their courage became the foundation for truth in the trials that followed. By the end of the war, the data collected from these horrors would vanish into reports, patents, and formulas that shaped future products. And the world, hungry for normalcy and beauty, would forget where those scientific advances began. But before the company could rewrite its story, the machinery of survival had to shift, from experimentation to preservation. In the offices of wartime Berlin, far from the camps, corporate executives met in rooms that smelled of tobacco and paper. On their desks lay ledgers, contracts, and carefully worded correspondence with the SS procurement office. There were no screams there, no blood, only signatures. The collaboration between industry and regime had become a well-oiled machine. For the cosmetic company, this partnership promised stability in a collapsing economy. The war had turned chaos into opportunity. Many businesses faced shortages of materials and labor. Others sought protection through political loyalty. By working with the Reich, the company secured access to chemical supplies otherwise impossible to obtain. The government guaranteed contracts. The SS guaranteed test subjects. Behind the numbers was a simple calculation: profit without accountability. Corporate leaders often framed their cooperation as scientific patriotism. Memos described the experiments as a contribution to the German soldiers' resilience. It sounded noble, almost humanitarian, when written on company letterhead. But every test at Ravensbrück was a transaction of flesh. After 1945, when the Reich crumbled, those same executives were quick to adapt. They changed their tone, erased incriminating records, and emphasized post-war reconstruction. In the ruins of Europe, few wanted to dwell on guilt. Consumers wanted hope, healing, and beauty. exactly what the company could sell. New branding campaigns spoke of purity and trust. The dark origins of those promises remained locked away in the archives. What makes the corporate angle so chilling is its ordinariness. These were not monsters, but businessmen. Men who went home at night, kissed their children, and balanced morality against market share. Their complicity was not born of hatred, but of indifference, the quiet belief that what happened behind the wire did not concern them. It was the same logic that allowed an entire industrial civilization to serve a genocidal regime without ever raising its voice. The story of this company, and others like it, forces a question that reaches beyond history. How does a society so advanced, so cultured, turn cruelty into commerce? The answer lies not in ideology alone, but in the erosion of empathy. When moral principles become negotiable, when success is measured only by results, ethics dissolves into convenience. In Nazi Germany, the moral order was inverted. Compassion was weakness, obedience was virtue. The Cosmetic brand, operating within that moral vacuum, convinced itself that testing on prisoners was not murder but science. They spoke of efficiency, patriotism, progress, words that concealed atrocity. The true crime was not only what they did, but how easily they justified it. Even after the war, silence became another form of collaboration. Few corporations were held accountable. Some paid small fines. Others simply changed their names. The world was eager to rebuild, to move past the ruins. The victims' voices were drowned by the noise of reconstruction. In that silence, the company flourished again. Its products sold in the very countries once bombed by the Luftwaffe. The moral weight of such history cannot be measured in court documents. It lingers in the shadows of everyday life, in the stores that sell beauty products, in the advertisements that promise renewal and perfection. The irony is unbearable. A cream once tested on broken prisoners now marketed as a symbol of care. It is not only the company's story, but a mirror held up to modern society, showing how comfort often rests upon unseen suffering. The post-war generations would learn of Ravensbrück through testimonies and photographs. Few would connect it to the corporate logos they saw daily. The company's silence became a kind of victory, the erasure of guilt through the passage of time. But history, as always, has its own persistence. Decades later, researchers began tracing the chemical patents, production records, and experimental data back to their origins. The truth surfaced slowly, fragment by fragment, until it could no longer be denied. The moral angle of this story is not confined to the past. It warns of the danger when profit outweighs principle, when human life becomes data, and when cruelty is masked by the language of progress. The company's wartime legacy is not just a chapter of history, it is a case study in moral blindness. Its story reminds us that evil does not always announce itself with violence. Sometimes it wears a lab coat, signs a contract, and smiles behind a brand. As the war neared its end, the facade of scientific purpose began to crumble. The same companies that once boasted of service to the Reich now rushed to protect their image, burning documents, renaming products, and denying all knowledge of the camps. But some evidence escaped the flames. Reports, letters, and testimonies, fragments of truth that would one day return to haunt them. That reckoning began in the spring of 1945, when Allied forces liberated the camps. What they found would change the world's understanding of science, industry, and human cruelty forever. April 1945. The Reich was collapsing. Soviet artillery thundered toward Berlin, and Allied bombers filled the sky. In Ravensbrück, the once strict order of the SS began to unravel. The guards were nervous, the doctors desperate. But in the laboratories, the work continued, as though the war outside did not exist. The experiments, now in their final phase, reached their cruelest point. The SS doctors, fearing they would lose their data, accelerated their tests. New batches of the Cosmetic company's formulations arrived in plain brown crates. There was no brand name, only coded serials R305, R309, R312. Inside the camp, the prisoners already knew what that meant. More wounds, more pain, More silence. The experiments intensified under Dr. Karl Gebhardt, one of Himmler's favored physicians. Gebhardt had been a prominent surgeon before the war. Now he served as both scientist and executioner. To him, Ravensbrück was not a prison, but a proving ground. He called the women his volunteers. They were anything but. Each day, the SS medical staff opened wounds on the women's legs and injected bacteria cultured from gangrenous flesh. The new creams were then applied to the infected sites. Notes were taken on healing times, tissue decay, and resistance. Some women developed sepsis and died within days. Others lingered, delirious with fever. The results, their agony reduced to numbers, were sent to Berlin for corporate review. In the company's wartime correspondence, one memo from early 1945 mentioned positive field results and requested further concentration of compound ratios. Those words, so ordinary in the language of chemistry, concealed human torment. The executives likely never saw the faces of those who suffered for their data, yet they continued to demand proof of efficacy. As Soviet troops advanced, panic gripped the SS hierarchy. Orders came to destroy evidence, burn documents, empty warehouses, eliminate witnesses. At Ravensbrück, some guards began killing prisoners to erase traces of experimentation. Others fled. The camp descended into chaos. But among the women, whispers spread. Liberation was coming. One morning, the firing stopped. In its place, the distant rumble of tanks. Soviet soldiers arrived at the gates on April 30, 1945. The nightmare had ended, but the truth was only beginning to surface. Inside the camp's infirmary, investigators found jars of ointment labeled with the company's chemical codes. They found notes describing each test group, each reaction. The records were clinical, precise, detached. To the soldiers, the scale of the cruelty defied comprehension. Piles of bodies lay beside hospital beds. Survivors were too weak to speak. Yet even in their silence, the evidence was undeniable. Word of the discoveries reached the Allied command quickly. Within months, the Nuremberg Medical Tribunal began gathering evidence. Among the piles of documents seized from laboratories across Germany were letters linking the Cosmetic brand's research to the SS Medical Corps. The company's representatives claimed ignorance, insisting the shipments were for field hospitals. But the language of the documents told a different story. What shocked investigators was not only the brutality of the experiments, but the normalcy with which they had been conducted. Each step was documented, each result logged as though the subjects were lab animals. The idea that such precision could coexist with such horror marked a turning point, not only in the war, but in humanity's understanding of its own capacity for evil. For the prisoners who survived, liberation did not bring peace. Many carried lifelong scars, both visible and invisible. The creams that promised healing had instead become instruments of torment. Yet their testimonies became the foundation for truth. They remembered the faces of the doctors, the smell of disinfectant, the cold touch of the ointment on open wounds. They remembered the brand name whispered in the lab, the one that would later reappear in stores. The liberation of Ravensbrück was not just the end of a camp. It was the moment when the world began to see how deeply the machinery of genocide had intertwined with commerce and science. The same hands that mixed cosmetics had also mixed compounds for experiments on the condemned. As investigators dug deeper, they realized that this was not an isolated case. Dozens of companies, pharmaceutical, chemical, cosmetic, had built fortunes on the suffering of prisoners. But among them, one brand stood out for its post-war transformation, its ability to erase its past and re-emerge as a global symbol of beauty. The war was over. The world was rebuilding. But the truth buried in those jars would not stay silent forever. When the fighting ended, the world turned from battlefields to archives. What the Allies uncovered inside Germany's laboratories was as chilling as any weapon. Crates of chemical jars, coded reports, and correspondence between corporate offices and the SS told a quiet but undeniable story. A web of collaboration hidden beneath layers of technical jargon. The Cosmetic company, once a symbol of domestic gentility, had left fingerprints across the machinery of Nazi experimentation. At first, it seemed impossible that a firm devoted to beauty and skincare could be linked to such horror. But the documents were clear. Research samples sent to the SS, experimental data returned from camp physicians, formulas adjusted according to human trial results. It was the cold, bureaucratic precision that stunned the Allied investigators most. Each experiment had been logged, each body reduced to data, each death transcribed into a line of progress. The Nuremberg Medical Tribunal, convened in December 1946, exposed the extent of these crimes. Photographs of the Ravensbrück rabbits, the scarred Polish women, circulated in courtrooms and newspapers, their testimony delivered with unflinching clarity. They described the smell of burning flesh, the pain of infected wounds, and the jars of ointment applied under orders. The tribunal called these acts crimes against humanity masquerading as medicine. But when investigators traced the paper trail to the corporate headquarters in Berlin, they found little resistance, only denial. Company officials claimed they had no knowledge of where the creams were tested, insisting that they believed them to be used in hospitals for wounded soldiers. They presented sanitized versions of contracts and destroyed the rest. The executives were educated, articulate, and careful with their words. Most were never prosecuted. What saved them was not innocence, but convenience. Post-war Europe needed economic recovery. The Allies sought to rebuild industry quickly to stabilize the continent. Prosecuting every complicit business would have meant dismantling the very infrastructure required for reconstruction. And so silence became policy. The Cosmetic company resumed production under new management, its past quietly redacted from history. In the following years, the same formulas developed during the war, refined, rebranded, repackaged WWII, appeared in peacetime markets. The jars were elegant now, the labels soft and modern. There was no trace of their origins. Advertisements spoke of renewal, youth, and purity. No one mentioned Ravensbrück. Consumers, weary from war, wanted comfort and normalcy. The company gave them both. Meanwhile, in Eastern Europe, survivors gathered their testimonies. They wrote letters to international organizations, demanding recognition and justice. Some were published. Most were ignored. In the West, the brand expanded, its logo printed in glossy magazines and department stores. The silence had triumphed over memory. Yet fragments of truth survived in the archives, in coded lab notes, in SS correspondence, in the testimonies of doctors who confessed under pressure. Decades later, historians began to connect these fragments. They found procurement logs matching company shipments to Ravensbrück's medical block. They uncovered letters from chemists discussing positive results in controlled environments, and they found one haunting memo written in early 1945. The preparation demonstrates high regenerative capacity under human trial conditions. Further tests pending. The phrase human trial conditions became a chilling euphemism for what truly happened. By the 1960s, the brand had become an international name, sleek, trusted, and unblemished in the public eye. Its past, buried under corporate secrecy, remained largely unknown to the public, but the moral reckoning could not be postponed forever. Survivors, aging and determined, began speaking openly about the companies that profited from their suffering. Journalists followed their trail, exposing connections between wartime experimentation and post-war commercial products. The revelations shocked a generation that had grown up believing the horrors of the camps were confined to the military and political elite. Few had imagined that the industries that sold everyday goods, soap, perfume, cream, had also served the Reich's science of destruction. The turning point was not only in the discovery of these truths, but in the world's reaction to them. The myth of corporate innocence crumbled. The idea that business could exist separate from morality was shattered. The same laboratories that once mixed lotions for soldiers and civilians alike were now seen as sites of complicity. Still, for many victims, justice remained out of reach. Most companies avoided trial, hidden behind mergers, name changes, and legal settlements. But the evidence persisted, and so did memory. The liberation of Ravensbrück had opened the gates to truth, yet what emerged was more than horror. It was revelation. It showed how ordinary institutions, companies, doctors, scientists, could become instruments of atrocity simply by doing their jobs too well and questioning too little. In that realization lies the true climax of this story. Not the discovery of crimes, but the recognition that evil does not always wear a uniform. Sometimes it wears a lab coat, sits in a boardroom, and writes a memo about efficiency. And from those ashes, the world would soon face an even harder question. What happens after the truth is known? The war had ended, but the reckoning had only begun. Across Europe, the ruins of the Third Reich stood as monuments to both destruction and denial. The Nuremberg trials, held between 1945 and 1949, sought to expose the machinery behind Nazi crimes. Not only the soldiers and politicians, but the scientists, doctors, and businessmen who had made those crimes possible. The Nuremberg Medical Tribunal was the first of its kind, a court dedicated entirely to investigating medical atrocities. Inside the Palace of Justice, prosecutors laid out the evidence: surgical photographs, lab reports, camp ledgers, and letters signed by SS doctors. The victims of Ravensbrück took the stand one by one. Their testimonies silenced the courtroom. They described open wounds filled with dirt to induce infection, amputations without anesthesia, and ointments applied not to heal, but to observe decay. The names of the doctors were read aloud: Gebhardt, Fischer, Hertha Oberhäuser. But behind their crimes stood the industrial partners who had supplied the means. Memos between SS medical staff and company representatives surfaced, discussing sample consistency and distribution quantities. It became clear that the experiments had not been rogue operations. They were systemic, organized, and supported by industry. Still, when the verdicts were delivered in 1947, justice proved uneven. The doctors received sentences, some to death, others to life imprisonment. But most of the corporate figures avoided prosecution. Their role, though essential, was too easily obscured by layers of bureaucracy and legal technicality. Prosecutors focused on individuals who had performed the experiments, not those who financed them. The world wanted closure, not an economic collapse. In West Germany, the new government sought to rebuild industry under Allied supervision. Corporations that had once armed the Reich or supplied its research quickly rebranded themselves as agents of reconstruction. The cosmetic company at the center of the Ravensbrück trials quietly reorganized under new ownership. Its wartime executives resigned or retired. Within a few years, it had resumed international trade, this time exporting not medical supplies, but beauty products. The post-war years were an era of forgetting. Europe was exhausted, eager to look forward rather than back. The company's advertisements returned, showing smiling women and radiant skin. The imagery of purity, once aligned with Nazi propaganda, now sold post-war optimism. The transformation was complete. A brand reborn from ashes, cleansed by the collective desire to forget. But not everyone forgot. Survivors and a handful of journalists kept the story alive. In Poland and France, women who had suffered the experiments formed associations to document war crimes. They sent letters to Western governments, demanding accountability from the companies that had supplied the SS. Most letters went unanswered. Corporate archives were sealed, citing proprietary research. By the 1950s, the company's name was again respected. Its products filled store shelves in London, Paris, and New York. Few customers realized that the smooth texture of the cream they applied to their faces was born from experiments in a concentration camp. History had been repackaged, sold in small glass jars. The irony of the post-war era was stark. While Europe tried Nazi doctors and rebuilt its moral identity, it also rewarded the very corporations that had made their crimes possible. Industrial expertise became more valuable than ethical reflection. Science marched forward, leaving its ghosts behind. Yet beneath the surface, the truth still waited, in archives, in unmarked graves, and in the memories of those who survived. And by the late 20th century, as historians began to reopen the files, the company's silence would no longer be enough to bury its past. The first cracks in that silence began with a single question, asked not by governments, but by ordinary citizens and researchers who refused to let history fade. By the late 1970s, Europe had entered an age of reflection. The survivors of Ravensbrück were aging, but their memories had not dimmed. Historians and journalists began tracing the wartime connections between Nazi medical research and private industry. What they found reawakened old ghosts. Among the files unsealed from German archives were faded letters and invoices, linking pharmaceutical and cosmetic companies to the SS Medical Corps. One of those companies, the one whose cream had been tested on prisoners, was still thriving, its brand name now synonymous with modern beauty. The revelations began quietly, in university papers and investigative reports. A historian researching the Ravensbrück experiments discovered coded references to corporate test samples in surviving SS documents. The trail led back to a major cosmetics manufacturer whose archives contained identical chemical formulations. The ingredients matched, the timelines aligned, and the correspondence bore the same signatures. The conclusion was unmistakable. The company's product, refined, rebranded, and sold globally, had its origins in human suffering. Public outrage followed, but it came slowly. The postwar generations struggled to reconcile the image of a trusted household brand with the horrors of concentration camps. At first, the company denied the allegations, calling them unsubstantiated historical coincidences. When confronted with evidence of shipments to the SS Medical Office, they shifted the narrative, claiming coercion, ignorance, or that the wartime entity had been a different legal organization. Lawyers crafted careful statements. Spokespeople expressed vague regret for all wartime suffering without admitting responsibility. Yet the survivors' testimonies refused to fade. Journalists interviewed women who had endured the experiments. Their voices were calm but heavy, their scars visible proof. "We were used," one survivor said, "like samples in a factory." The world listened. Finally, boycotts followed in some countries, and academics pressed for greater transparency in how corporations documented their pasts. Still, true accountability never came. By the 1980s, most of the executives involved in the wartime collaboration were dead. The company continued to grow, expanding into new markets with slogans about trust and care. The history of its involvement in Nazi experiments became a footnote, mentioned in academic circles, rarely in the press. But the shadow of that past never fully disappeared. Each time an investigative documentary revisited the topic, the brand's legacy was re-examined. Each time it sparked the same uneasy question: how could a symbol of comfort have been born in a place of horror? The truth is that modern prosperity often rests upon layers of forgotten pain. For decades, the company's success was built on silence. A silence maintained by shareholders, consumers, and historians who found it easier to move on than to look back. But history has its own persistence. The truth, once buried, always finds its way to the surface. In the 21st century, new scholarship and digital archives made concealment impossible. Declassified SS records and surviving company memos were digitized, allowing historians to reconstruct the full chain of complicity. The evidence, once scattered, became undeniable. Public debates reignited. Should the company be held accountable posthumously? Should it fund memorials for its victims? Some demanded reparations. Others argued that acknowledging the past was itself an act of justice. Today, the brand still exists, a polished emblem of modern beauty and science. But beneath its clean marketing and minimalist packaging lies a legacy written in blood and silence. Few consumers know the full story. Fewer still want to. The story of this company's wartime collaboration does not end with punishment or redemption. It ends with memory, fragile, contested, and incomplete. The women of Ravensbrück did not live to see justice in a courtroom, but their testimonies ensured that history would not be erased. And so, when one opens a jar of cream today, smooth and white beneath the lid, the question lingers quietly beneath the surface. What price was paid for beauty? History does not always end with justice. Sometimes it ends with forgetting, until someone chooses to remember. The story of the cosmetic brand that profited from pain is not merely about one company or one crime. It is a reflection of humanity's ability to bury truth beneath comfort, to trade morality for convenience, and to disguise cruelty beneath civility. The same world that condemned the camps later bought the products born from them. That is the true legacy of silence. The women of Ravensbrück are gone now. Their bodies, once used as experiments, have returned to dust. But their courage, their decision to testify, to speak the unspeakable, gave history its conscience. They forced the world to confront what happens when ordinary institutions lose their humanity. They showed that evil is not always loud. It can be polite, efficient, and profitable. It can exist in the laboratories of respected scientists and in the boardrooms of powerful companies. The brand itself thrives today, cleansed by time and corporate rebranding. Its commercials speak of purity, science, and renewal. Few who see them realize that the language of beauty was once the language of ideology, that the promise of purity once justified unspeakable acts. This duality, this contradiction, is what makes the story unforgettable. It is not about cosmetics. It is about conscience. The world after 1945 promised never to repeat such horrors. Yet every generation faces the same temptation, to look away when progress demands a moral price. History's warning is clear. Cruelty rarely begins in darkness. It begins in indifference. The jars used in Ravensbrück have long been destroyed. But somewhere in museums and archives, fragments remain. Brittle paper, faded handwriting, a few surviving labels. They are silent witnesses to what happens when beauty becomes blind, and when human suffering becomes data. Remembering their story is not an act of accusation. It is an act of preservation, a reminder that truth, however painful, is the only antidote to amnesia. Because behind every gleaming surface, behind every promise of perfection, there may still lie a past the world has chosen to forget.